To my state legislators, my name is Jordan Stimulus, and today I will be discussing policy alternatives to the recently proposed BMI screening policy. To begin, I want to discuss the extreme need to not only address the physical aspect of BMI screening policies, but the social, psychosocial, behavioral, and cultural impacts this wellness plan has on students, caregivers, and other potential stakeholders. Despite its recent attention, there has not been enough evidence to suggest school-based BMI measurement programs are effective at preventing or reducing childhood obesity and or whether they cause harm. These harms have been associated with increased stigmatization of obesity, lower self-esteem, increased body dissatisfaction, disordered eating, and parental promotion of dieting, leading to unsafe weight control behaviors by the students labeled as overweight or obese. With this said, it is important that state policies are developed with the respect of students' total health. Here you can see the evidence that further supports the claims which find school-based BMI screening policy to negatively impact students. In summary, a student's failure to understand their BMI category largely contributes to decreased self-esteem and increases their risk of developing an eating disorder. This, coupled with students labeled as overweight or obese, are more likely to have parents with a higher inclination to implement diet-related activities with no plans to seek medical advice. To mitigate these harms, school-based BMI screenings present to students' overall health. The following policy alternatives have been proven to have a more beneficial impact on all potential stakeholders. One potential alternative to the proposed BMI screening policy would be to instead delegate resources and funding to improve school and food environments through the limitation of competitive foods. This alternative has been found to have a more positive effect on dietary practices and behavior changes. Implementing this highly impactful strategy improves overall health of students by decreasing habitual sugar-sweetened beverage intake by 0.18 servings per day and unhealthy snack consumption by 0.17 servings per day, costing schools a mere 23 cents per student per day. The second policy alternative poses a policy addition if state legislators are set on implementing school-based BMI screening. By ensuring the 10 Centers for Disease Control Prevention safeguards are upheld with the BMI screening, intervention, respect for students' privacy and confidentiality, as well as a protection from previously mentioned harms can be assured. Having these 10 safeguards will increase the likelihood that the program will have a positive impact on promoting a healthy weight, despite the very costs previous studies have found based on the number of safeguards already in effect in schools. Students, caregivers, and the local community will appreciate the lengths the state government will go through in order to address the concerns these safeguards were specifically developed for. Here you'll find the 10 CD safeguards. And in conclusion, it can be agreed that the complexity and multifaceted nature of obesity will not have a single solution. As state legislators develop policy to tackle this public health issue, the community implores state to develop system-based approach to obesity prevention, which recognizes policy, environmental, and individual level factors that affect students' behavior as well as the outcomes associated with obesity prevention. The policy alternatives I have presented to you today hopefully encourages the state to strongly consider other options to obesity prevention for students in grades K through 12, such as the improvement of school food environments through the limitation of competitive foods and or preemptively mitigating harms associated with BMI screening policies by ensuring the proper safeguards are in place to address the concerns of the stakeholders affected by the state policy. Thank you.